I'd like to thank Sean Peterson from the India Street Public Health Department in Portland for these slides, which she introduced me to last semester for pharmacology. I've decided to focus upon this particular aspect of HIV care and prevention, as it is quite applicable in the primary care setting. If you refer to the HIV guidelines, which I have posted for your reading and also in your book, of course, you know about testing for HIV by doing HIV antibody testing, and there are instant tests that can be done with saliva samples, and we do that through the public health department in screening events, and that can be done also at home by patients as well as in office. So once we identify HIV as being positive in terms of the antibody, we go further to test them to check their CD4 counts, and then we would refer them to a specialist in HIV care to manage the administration of antiviral medications and move them forward in terms of ongoing monitoring. This, however, is a little bit different and quite appropriate for primary care, where we may identify high-risk individuals who are currently not HIV positive but are engaged in behaviors that would warrant some prevention. So just stepping back for a second in terms of the statistics, the annual surveillance reports through the CDC in Maine took a look in the last 5 years. So for 4 years, things were fairly stable. 2014 saw a little bit of a peak, and then in 15, a little drop back. So again, numbers are fairly stable in terms of newly identified cases of HIV in the state of Maine. So it's not a huge deal, but we're really hoping to keep it a small deal in the state of Maine. So this is a poster that they use at the Public Health Department to introduce patients to the concept of PrEP, which is pre-exposure prophylaxis. And this kind of treatment is developed to prevent a person who is exposed to others who have HIV and by their behaviors are exposed, and they can prevent the conversion. Of course, the rationale being that prophylaxis in general is a great concept. We think of it as, taking medication for malaria for travelers to prevent getting malaria, even though they may well be exposed to the disease. In terms of HIV prevention, we already have evidence in terms of vertical prevention that treating mother can prevent mother-to-child transmission. And in 2012, there was a medication approved, Truvada, which has 2 antiviral medications included in it for PrEP. We focus our attention on men having sex with men. We look at adult males without acute or established HIV infection. If they've had male sex partners in the last 6 months, and also it's having sex with women, there may be exposure as well. They're not in a monogamous partnership with a recently tested HIV negative man. And the following occur: any sex without condom, receptive or insertive, any STI diagnosed or reported in the last 6 months, and of course a person who's in an ongoing sexual relationship with an HIV positive male partner. So this is the focus population. So this is an example of the checklist that they use on intake, and there's a provider section which goes through kind of a nice punch list on how to help the person through the whole process. One of the things that Sean was very emphatic about in her talk to us was that the discussion about sexual practices, especially for persons who may be having different sex practices than the provider uses, is a fairly uncomfortable place for providers to be, especially at first, and that she urged us to really step up our skill set in terms of motivational interviewing skills and kind of meeting the patient where they are in terms of their behaviors and helping them identify those things in a non-judging way. Things like asking a person, do you have sex with men, women, or both? How does that go? how many partners, just in a very matter-of-fact way, and rather than avoiding the subject. And this is primary care. It's really our responsibility. So, of course, don't forget STD or STI screening for men having sex with men. Every 3 to 6 months is recommended for high-risk MSM patients. And of course, there is the rectal GC chlamydia probe that can be done. There's urine, checking the pharynx if they're a receptive partner for oral sex, and in all cases, serology for HIV and syphilis are important. And here's a little case example. A patient is on PrEP for a 6-month checkup. He reports he's taking his Truvada daily, using condoms about 50% of the time. And then you know that he is both top and bottom sex involved, but mostly bottom, and gives and receives oral sex. And so the question is, what should we do? And we just test for HIV and do an oral swab, HIV and oral and anal, or just HIV since he's using condoms half the time. And of course, the answer is B for both oral and anal swabs, checking for everything, because he can still have GC chlamydia even if the HIV has been prevented by his taking of the medication. Just a little side comment too, she quoted some studies where they have looked at, when they did the FDA trials for the Truvada, that they actually had almost 100% prevention or lack of conversion in the population they studied, a lack of conversion from non-HIV to HIV status. There might have been 1%, but if they used the medication, they did have prevention. So it's very encouraging. This is going back to my comment earlier about us as providers making sure to discuss with people, and these are the references she gave. And then there is this study that she quoted, acceptability and willingness among MSM to use tablet-based HIV risk reduction in a clinic setting. So there is an app in terms of looking at treatment for STDs. If you are interested, and I know that's not really the focus of this because we're looking at HIV per se, but she did remind us of this. That's quite easy to get on your phone to access the latest treatments. She made a plea for us to stay updated with those treatment plans, since there's been some recent surveys that primary care providers are behind the times with their treatment plan for STIs, GC, chlamydia, syphilis, and HIV being a different kind of thing. Usually those are referred out. She offers the contacts here in case you have any questions for her. She's a great resource, and she would be glad to hear from you.